the Haemochromatosis Society Patient Case Studies 2018. Meet Mike Davis, 70 years old and diagnosed 18 years ago. Mike, how did they arrive at your diagnosis?
Looking back on it, it probably was over a period of 3 or 4 years where I was getting a series of different diagnoses for different things. And on one occasion, my GP sent me for some routine liver tests. And as a result of that, there were some concerns about iron levels, and I was then sent for a genetic test, and that's when I got the diagnosis.
And your treatment?
Classic bloodletting on a weekly basis over a period of about 18 months or so.
Any concerns in the family?
The biggest concern, I think, was probably related to my son, who was about 22 at the time of my diagnosis, and his GP was very reluctant indeed to send him for ferritin testing because he didn't feel that it was going to be a problem. Even if he was identified as having GH, it wouldn't have been an issue for him because of his age. And it probably took 10 years before that situation was satisfactorily resolved.
And how are you now?
Well, my treatment stopped quite some time ago. I feel far better now than I think I was at that time, for sure.
How did you find the medical profession?
My GP in the first instance was curious but probably not sufficiently proactive, and he would own up to that. He recognised that there was a problem. He wasn't entirely sure what it was and how to go about it. He was subsequently very supportive. So many of my conditions were associated with, I think, age and lifestyle, that to a certain extent they weren't ignored, but they were not associated with GH. And I think this is part of the challenge, that people they get to a certain point in their life where iron has built up, it's started to affect multi-systems, but when they go to their GP said, well, it's because you are overweight, you're of a certain age, you drink too much, or whatever the condition happens to be, has got a perfectly plausible explanation. And that satisfies both the medical profession, but also people going away thinking, well, okay, I'm diabetic, so I've got to make sure I manage my diabetes, rather than managing the haemochromatosis, which is relatively more straightforward.